The purpose of this film is to spark conversations and establish touch points to guide discussions about the COVID-19 pandemic in a way that is grounded in clinician and healthcare workers' experiences. This film was created using footage from interviews of people who agreed to share their stories of working in La Clinica de Familia during the COVID-19 pandemic. The clips you will see were selected because they represent common patterns. Participant voices and personal experiences differ, but they shared a belief that telling their clinic story would matter. In some instances, people were willing to share, but were not comfortable being on video. Not everything you hear will be directly relevant to situations at present, but each story can spark ideas and conversations that allow for insightful discussion of the pandemic. Catalyst films are part of the broader, wide engagement for assessing COVID-19 vaccine equity, or WEAVE project. More information about the WEAVE project can be found at www.weavenm.org.
Some places may be shut down temporarily. That was not an option for us, and it was not something that we would have even considered, that our doors were open to anybody and everybody. We actually, I think, saw an increase in referrals during COVID. People were seeking mental health services, and a lot of places were just not offering at that time, and we were. So I saw that a lot of people were very grateful for that.
But because we all had to come together, it impacted the whole organization, right? Everything you do, it's a domino effect. And so that's something that I think has really strengthened us as an organization.
It was a very stressful time for everybody, not just me as a member in the community, but also as an HIT manager.
All of us were isolated, and it's hard to, see family or, friends, and then also, having relatives or family members pass away. So I think that's one of the biggest things that has affected me as, also as a person, but also in my practice. And I just remember in the middle of summer, right, it's like 100 degrees outside and you're wearing full PPE. So it's like wearing a trash bag over your clothes, over a mask, over a face shield. So you can imagine, just it was just, horrible conditions. And we started off with a very small operation that built up, to testing hundreds a day. And eventually, we made it into a really well-oiled machine of testing and then eventually vaccinating. We vaccinated, you can say like thousands of Southern New Mexico residents, as well as testing thousands of Southern New Mexico residents.
Access is one of the biggest things we as a country, I think, still need to work on, because I hear it all the time. So if I work from 8 to 5, I can't go get a vaccine. If I miss work, I don't get paid. Those are the jobs of the majority of people. Not everyone works in a job that has annual leave, sick leave.
We did have promotoras present at some of our vaccine sites. They were all bilingual. And like I said, they're all from the community. So, some of these small communities, everybody knows everybody. So when you see somebody familiar, you can, there's that added trust.
The pandemic started, I've been the only promotora for all the clinics. I'm in communication with the other promotoras, and as I mentioned, we're about 30 promotoras, and we're all in the community from El Paso to New Mexico. So we share on both New Mexico and Texas.
Well, a lot of our patients really enjoy the telephone more so than, coming in, because it's so convenient, right? Like we have migrant workers. So, they could actually work in the fields, take a break, get on the phone and call us, and we do a telephonic visit over the phone, because we deal with a population that might not have PTO sick time, right? So maybe they only have 15, 30 minutes or during their lunch times.
Well, the good part of this organization for La Clinica is we actually had funding to have what we call a COVID team. We had the ability to get an old RV, and we took the RV to different locations to do COVID testing and eventually vaccination. It was great. We were taking through Santa Teresa, going to Sunland Park, really in the borderlands between New Mexico and Texas.
We're finding that our patients across the border are willing to get vaccinated. I don't see a lot of resistance. And I will tell you, we partner with Department of Health and down at Santa Teresa, wherever our migrant migrants are, that's where our mobile unit will be set up to make sure that they get their vaccines. And I think our patient population they have been a lot more receptive to the vaccine than actually the general population as a whole, because I think that we're decreasing that barrier, right? Which is, bringing the vaccine to them instead of them having to come to the vaccine. And I think that's important for any organization to make sure that we go to the population that needs it and the most vulnerable population.
The rural areas were, I think, hit hard because, number one, there's no real healthcare infrastructure in the rural areas. And then most of the big cities had eventually the big testing sites where they would test like hundreds, an hour or so. But going from, the rural areas and showing that we could test and provide these services for these people, I think was the most rewarding part. Is, after this quarantine and after being isolated, I've seen an increase in the demand for behavioral health services and an increase in, depression and anxiety.
The other great thing about our organization is that we have integrated behavioral health, but, because of COVID, obviously we had to do telephonic, and our patients were very receptive just to talk to them about, like, what are the stressors? What are some tools? How can you be able to cope with COVID and do what is your support system?
We've actually had a high amount of referrals after COVID. Is one of the things that we have a lot of clients coming here for is grief and loss.
Little did we know our biggest enemy was misinformation. Never in 1,000 years would I have thought that I would have to teach patients to unlearn what they have learned. It was an opportunity to educate the patient, and we did, as we do with every other disease process. But it was infuriating to see people on Facebook, people on the news, thoroughly disseminating misinformation. It was undermining the very essence of what we do, as providers in the medical field. And we just felt helpless. When the vaccinations came, it felt great because you could put it in people's arms and you could protect them. We also ran into people who basically vilified you.
They were listening to the tia, to the mom, to the aunt, to the, and getting information that maybe wasn't true. And they were getting scared to get in the vaccine because politics, because they say, oh, I don't agree with it because I'm a Republican or I'm a Democrat and I don't agree with it. I don't think it works.
If we take the approach of telling them you need to get vaccinated, you have to do this, then we risk the alienating our clients. And so they don't come back, they disappear from services, and then they don't get the help they need.
It's an opportunity to educate the population in terms of what research truly is, what the scientific method truly is.
I think we need more people on the ground providing education. We need more people on the ground as promotoras, as community health workers. Some of them are the lowest paying jobs, but they're some of the most important people in our organizations.
This has just opened the doors for things to be accessible to people. So I think what we've learned is that the old ways don't necessarily mean that it's the right way or it's the best way.
Humankind has a very short memory. It would behoove us to learn from our history, or else we're doomed to repeat it again.
I think that in memory of so many people that we lost, so many good friends, family members, parents, I think the most important thing that we can learn from this is that as a community, we need to come together and help each other out.
The community here is an amazing community, that there have been so many different resources for people in terms of, okay, where can we go to access donations if we're out of work because of the pandemic? Where can we go to get help with things like utilities? And then looking just looking at those little things that people have pulled together of supporting each other. People can adapt and change. Even if things are difficult, we are able to work through it.
I love my community, and I believe helping them, it's giving me a lot of peace that at least I'm doing something